Embrace Life with Renai is back, and we are dedicating this half hour of programming to our brand new sponsor, Lourdes Health System. Our next guest is also from Lourdes. Her name is Christina Hunter, and she is a nurse navigator. She's here to teach us a little about breast cancer screenings, life after breast cancer, and breast cancer prevention. Welcome, Christina.
Thank you. Thank you very much for having me.
Oh, it's a pleasure to have you on the show. So what does a nurse navigator do for patients?
As a nurse navigator, I actually get the opportunity to walk patients through their journey with cancer.
Okay.
So at the time that they're diagnosed, especially at Lourdes, I'm their first contact, where I actually will reach out to the patient when they're diagnosed. I explain to them what's going on, because initially once they hear they have cancer, that's all they hear.
Right.
So I sort of become their go-to person when they have questions, or maybe they forgot something that we had already reviewed. I set up all their appointments with the oncologist, the radiation oncologist, the surgeon, any special testing that they may need, any scans. I can help them and their family with that, because it's not just the patient's diagnosis, it's the family's diagnosis.
Exactly, like Dr. Greatrex had mentioned earlier. And it's so nice to know that you exist, that there's someone who is a health professional who can kind of take the patient by the hand and walk them through that, what could be a very traumatic process.
Oh, absolutely. And also making sure that the patient is being treated in a timely fashion and not getting lost to follow up or making appointments, not sure where to go next. And I'm actually there to make sure that they get to the places they need to go and they're being treated promptly.
So what is the answer to the question, can cancer be prevented?
It's not an absolute. There's things that we can do to reduce our risk of developing cancer, any types of cancer. One of the number one cause of cancer, which most people are surprised, it's diet. In a country where we do tend to be overweight, weight can be an issue. Having a healthy body weight, eating whole foods, especially fruits and vegetables. Just like the American Heart Association, the American Cancer Society also advocates for having 5 fruits and vegetables every day. That helps to reduce risks of certain types of cancer. By getting lots of sleep, being active, exercising, they're all very important to having a healthy lifestyle, minimizing the use of alcohol, not smoking. We know for sure with the elimination of tobacco products can dramatically reduce certain types of cancers.
And we talked a little bit about the importance of the mammogram. Can you just take me through the importance of screening?
The importance of screening is really, from what I've seen in my practice, is a matter of life and death. By able to get your mammogram early, we can pick up cancers in a very early stage, in a stage 1. If a woman's getting her mammogram every year, we're able to actually track any changes that happen. And if we can pick up that cancer early, the treatment for the woman is most likely going to be much easier. It could be a simple a lumpectomy and radiation. When it's further along, if it's in the lymph nodes, if it's spread anywhere else, we're now definitely involving chemotherapy, hormonal therapy, maybe more advanced surgery. So being able to diagnose cancer early, especially breast cancer, it's a matter of life and death for some women. There are certain breast cancers that are more aggressive than others. Some grow slower, some grow very aggressively.
And there are certain people that I've heard who have elected, because they have a certain gene, to get a mastectomy or a double mastectomy. Can you talk to me a little bit about that?
The BRCA mutation, some people call it BRCA, BRCA mutation. It's a mutation that is actually not as common as people think, because it is on the media. We have celebrities who have tested positive and have had prophylactic surgery. The gene mutation tells us that that person has a very high risk of developing breast and ovarian cancer over time. It's usually over 70% lifetime risk of developing either one of those cancers or both of those cancers. So in order to be proactive, women choose to have bilateral mastectomies and also possibly the removal of both ovaries to prevent those 2 types of cancers.
And you've mentioned the word early a few times. How early is early enough to have the mammogram?
The current guidelines have started at the age of 40, every year after the age of 40. The American Cancer Society has recently changed those guidelines. For the medical community and for people who are involved in oncology, the Oncology Nursing Society, different physician societies don't necessarily agree with the changing of those, and it's starting at 45. and it's sort of leaving it up to the patient and the person if they want to get a mammogram between the age of 40 and 45, and that it doesn't have to be yearly. They're supporting starting it at the age of 45, and then after, as you get older, then you would go to every other year.
Okay, thank you so much, Christina. We're going to be right back with more of Christina Hunter's information about breast health when we return with Embrace Life.